India has reported more than 3 lakh coronavirus cases over the last 24 hours, the highest daily global total. While COVID-related fatalities also jumped by a record 2,104 COVID deaths, India's daily jump in cases of 3,14,835 has surpassed the previous highest one-day rise in the world. Well, the country's caseload is at 1 crore 59 lakh 30,965 now, while the death count has increased to 1 lakh 84,657. Maharashtra, the worst affected state, reported 62,097 fresh COVID cases, taking the tally to over 39.6 lakhs. India is facing one of the biggest health challenges in recent years with the shortage of medical oxygen, hospital beds and antiviral drug remdesivir used in the treatment of COVID. The Supreme Court today termed the COVID-19 situation as almost a national emergency while agreeing to hear Vedanta's plea for opening of its Sterlite copper unit at Tuticorin in Tamil Nadu on the ground that it would produce 1,000 tons of oxygen and give it free of cost to treat patients. Joining us to look at this story in greater detail is a special panel. We have Dr. Ishwar Gilada, Secretary General of People's Health Organization, joining us live. Dr. Sameer Gupta, Co-Chair, Health Committee, PhD Chamber and Director, Cardiac Cath Lab, Metro Hospital is joining us live as well. Dr. Manjari Tripathi, Neurologist of AIIMS, is joining us live. Arvind Varchasvi, Chairperson, Ayush Committee, PhD Chamber, and MD Shri Tattva is also with us live. Dr. Swati Maheshwari, Internal Medicine Specialist, is also joining the panel live at this point on the broadcast. Let me also open this out to our viewers. Our viewers watching the broadcast can call in with your questions for our experts, also your thoughts, suggestions and opinions. We are taking your calls live. Our numbers are flashing there on your screens. We have Kabir joining us from Salem. Kabir, please go ahead.
Sir, I am a diabetic patient.
Okay.
Hello?
Yes.
I am a diabetic patient. Can I take this vaccination?
Okay. Let me take that question straight across to Dr. Ishwar Gilada. Dr. Gilada, our viewer there, Kabir, has a question. He is a pediatric patient. Can he take the vaccine?
No, currently the vaccines are okayed only for 85 plus because all the trials are done only in 85 plus. However, in USA and in Europe, they are doing a trial for 12 plus people, and till such trials are out, we cannot offer any vaccine to pediatric population. We do not know the dose, we do not know any outcome, we do not know safety profile, nothing.
You mean 18 plus? Because I think by accident you said 85 plus.
Oh, sorry, no, 18 plus.
Okay. Well, thank you. Thank you for answering that question. Let me quickly also bring in another viewer now. We have K. Mohanty joining us from Cuttack, Odisha. Go ahead, sir.
2 gaps of the doses. If one is infected with COVID, then can you take the second dose on scheduled date?
Okay, let me take that to Dr. Tripathi. Dr. Tripathi, our viewer from Odisha has a question. If one takes the first dose, then gets infected, can they still take the second dose at the earlier scheduled date, or should they wait more?
Yes, absolutely. They can take the second dose, but they don't have to rush to take it. The guidelines say that if you've taken the first shot and then because you're not fully vaccinated and your antibodies haven't kicked in, you could get the infection. So if you get the infection after the first shot, your next shot will be about 6 to 8 weeks or even 10 weeks later after the infection. So it will be, suppose you got infection today, it will be around 8 weeks from today, or even longer. You could wait for 8 to 10 weeks, or anyway ranging from 6 to 10 weeks. You should not miss the injection, second shot. You have to delay it, you have to postpone it.
Okay. You can just delay your shot, don't not take it, is what Dr. Tripathi is saying. Okay, other viewers can continue to call in, but let me quickly also get in some views now from our panelists. Dr. Sameer Gupta, we are seeing, of course, a very dire situation in the country, with India crossing that 3 lakh mark as well in the last 24 hours. Looking at the situation around, sir, do you believe we are heading to a pan-India lockdown? Is there no way out? And what do you believe should now be the priorities for our government in combating the situation? You're on mute, Dr. Sameer.
Unmute.
I'm sorry about that. Yeah, so I think that's a great question you're asking. That do we need a nationwide lockdown versus what the Prime Minister has suggested, a state-wise lockdown versus micro-containment zones? You know, the virus is very smart. I personally feel it goes around these containment zones very easily, and I think by this time all of us have had near misses. Some of us have, been infected, and some of us have, been lucky not to do that. I think we may be heading to a situation where there may need to be a nationwide lockdown, because the question is economy versus livelihood, right? I mean, that's been the eternal debate: lives versus livelihood. And right now, the way the lives are being affected, the livelihood is being affected too. And I'm going to give you a small example. Most companies right now across India have set up war zones where they're trying to help the family members of the employees or the employees themselves. My mother is sick, my daughter is sick, my niece is sick, or somebody's sick. I need oxygen, I need beds, I need medicines, I need doctor consultations. So the focus of these companies has probably changed over the last week or so. So the productivity of these people is actually going to reduce. So the economy is also going to be hit accordingly, right? It's not just the work is open and everybody's working. The mind of the people who are actually working is diverted. So if we go for a nationwide lockdown, it may not be, the economic impact of that may not be as severe as we think it is.
Can I come in here just to supplement Samir?
Yes, Dr. Gilada, please go ahead.
You see, if you have to really think of lockdown from medical point of view, there cannot be any better or greater time than this. Today, people are just asking oxygen. Now you imagine in 10 days, if these people are multiplying in double, or another 10 days, another double, where is oxygen? Where are situations, where are hospitals, where are beds? So there are only two options: 100% masking. If that is not possible, lockdown. If 100% masking is there, you can ensure that by, in Marathi we call Sam, Dam, Dand, Bhed. You do anything, but you mask. If that is possible, lockdown not required. Japan has never done lockdown, but they are controlled. So similarly we can do, but currently the situation is so bad, it is going bad to worst. We are going all over the country, span India, it's not 3-4 states, almost 15-16 states. Today only headline says 17 states and Union territories are in a very bad shape. So if we have that many patients coming up, and every day the graph is going to grow up, insecure people will be storing oxygen cylinder at their home. Industrialists will buy some equipments and have oxygen compressors. They will have some kind of internal arrangement. Please keep room reserved for me, presidential suite for me. What will happen for common people? So for common people, currently, I think the situation is so explosive. We do not want to make it further explosive.
Indeed. Dr. Swati Maheshwari, quickly coming back. Actually, let me bring in Dr. Manjari Tripathi, and then I'm coming to Dr. Maheshwari. Dr. Manjari Tripathi, we're seeing, of course, how there are certain states which are contributing the highest numbers. Do you believe, at least for these states, there must be some immediate, strict and stringent curbs? Otherwise, the hospital system will just collapse. It's already on the verge of that. It's overburdened. Some special rules, different curbs needed for those contributing the highest caseloads currently, Dr. Maheshwari. Dr. Tripathi, beg your pardon.
Well, yes, we should be considering stringent containment measures in states which are heavily burdened and in particular short of oxygen. Now, I can tell you that our people are, again, I'm very proud to be an Indian. But our people are not used to curtailing their activities. I will give you a small example. A family known in Delhi had fixed the marriage of their children. And so I think Delhi has put in some curbs onto the numbers. So they moved to another city out of Delhi for the marriage. So this is going to continue. Our people are not used to listening. They will not curtail their activities.
Yes, please go ahead. I'm just going to mute
and this will continue. So we really need, ironclad kind of lockdown, because our people just don't listen. This chalo 20 लोगों के साथ शादी allowed है, 4 लोग से ज़्यादा इकट्ठा मत हो, ये सब नहीं follow होगा, because there is no fear, because people who are not affected feel हमको तो हुआ नहीं है, हमको तो होएगा ही नहीं, और जब हो जाता है, then they start cursing the government, they start cursing the doctors, they start cursing the medical networks, they start cursing the corporate hospitals. So then all the cursing starts. But before that, they were indulging in all possible things which the government had clearly told not to do. If the government had told them wear a mask, let me tell you, even today people going for their walks are not wearing a mask. Okay? If the government tells you that don't accumulate in crowds, just yesterday there was a party behind my house for inauguration of a new building, and there was loud music and 20 cars parked there. So there is nothing which is, stopping people. They only stop when they get affected, and then they become violent and they start cursing the system. So there needs to be an ironclad containment in these kind of, zones where the number of cases are exploding. And really, our people are not the type that they listen. There are few who listen, who are afraid and who stay back. But most of them are just not bothered, I would say. At least this is what I'm witnessing in the city of Delhi.
Dr. Maheshwari, perhaps what is needed now is a stringent and concrete COVID action plan by the centre. SOPs at every centre, every central department needs to follow and work in tandem with the state governments as well. Is it time now for this COVID action plan? Already the Supreme Court is asking for an oxygen plan. We need a comprehensive action plan, not just on oxygen, but on multiple counts. Don't you believe, Dr. Maheshwari?
Absolutely, I totally agree. See, it's not just one phase that we are seeing right now, which is oxygen shortage. There are a number of collaterals which are attached to it, be it our medical staff, be the number of medical staff, be it the other medicine supplies that we are looking at, be at the testing level that we are looking at, the contact tracing. So there are many verticals to it, and as such, and I think it's a very pertinent time that the Supreme Court has really looked into it, and they are seriously pursuing the matter and seeing whether the government is doing the needful that is required. One thing that is very, very important here to understand is there are two things that we need to understand. One, we need to pull down our death rate and we need to keep it stabilized. That is the first most priority, because people will get infected and they will get better, so we can tide over from the epidemic. The problem is of the people who are getting sick and the people who are losing their lives, who should be losing their lives. The second is we need to understand the difference between the haves and the have-nots. So we have a lot of common people we have so much of our population who are actually not able to reach out to hospitals. They are the ones who are suffering the most, because people who are VIPs and people who have their links here and there, they are able to procure everything that is required. They are getting beds and everything is available to them. But it's generally the common man who's suffering. People are losing their dear ones every minute here in India. So definitely the center and the state government need to align now. And if we are looking at the logistics, we are saying that we have so much of oxygen, 40,000 tons of oxygen we are producing every year. And right now the requirement is 5,000 tons per day. And the problem is logistics. The problem is that we are not able to shunt oxygen from where it is being produced to the places where it is required. And then probably, we are really lacking in the kind of the planning that we are doing and the way we are strategizing the whole thing. So we really need to look at different verticals, and then are we really stepping up the junior staff that we have, the doctors, the would-be doctors? Can we channelize them? Can we channelize our technology? Can we use telemedicine and see if we can help more and more people sitting somewhere and then creating these oxygen wards or something which can tide over the shortage of the hospital beds that is there. So I think there are lots and lots of issues that we need to look at, and I agree that probably, since I was coming to the same point, that if 70% of the cases from India are coming from 10 states or something, then maybe we could look at a partial lockdown of clamping all these 10 states. The important thing is to cut down on the interstate movement. The moment we allow interstate movement, I think we are trickling the infection from one state to another state. So even if we don't put a complete pan-India lockdown, at least we can start channelizing the resources from the states where the infection rate is not very high to at least the states where the infection rate is high, and put a clamp down on all the states where the infection rate already has gone very high. Because as some of the panelists said, yes, this is a huge problem that people don't understand, and they are still a large section of society which are taking this very casually, and they are still not understanding the seriousness of the situation. They are going on with their usual ways and their usual routine, but it is the common man, I feel, which is suffering the most at this point of time, and some way or the other it is the community which is suffering the most right now, because they are the ones who are bearing the brunt. They are the ones who are looking after the people, and at the cost of their own lives, at the cost of their own near and dear ones. And you need to really understand that even our medical facility, the healthcare workers are getting fatigued out. It's not easy at this point of time to give services 24/7, and that too when we were fighting with this pandemic since last 1.5 years, and now suddenly with all this load falling on their heads, it's not easy for them to sustain as well. So somewhere or the other we need to use technology as well. We need to bring that, leverage that as much as we can, so that can we create consortium of doctors who can actually help with we create these oxygen beds at different society levels, at community level, and let the doctors, consortium of doctors, help and guide people how they can do home oxygen or oxygen facilities, at least create some makeshift plants. I think that is something which is very essential to tide over the gap that we have. Because see, hospitals, they also have their capacity and they also have a limit. You can't just say that we are increasing beds if we don't have doctors, if you don't have oxygen supply on those beds. So those beds are as good as the beds in our house. What we need definitely is to create makeshift kind of facilities where people can get immediate, medium, intermediate help, wherein they are not able to reach the hospital, but they know that they are taken care of and their immediate problems are being taken care of to the best of the capabilities that it can be. So I think that is where we really need to work upon, and the government needs to see how they can create these makeshift kind of, because what I'm hearing from people is once they get COVID positive, they do hear from the government and the CMOs and the different authorities. They keep calling them, they keep telling them that we'll be sending you medicines, we'll be sending you consultations and all, but that is where it is left at. So people are still complaining that we don't get medicines, we don't get supplies, and when a person gets sick, then we call these helplines and nobody picks up and nobody answers, and even if they answer, they are not responding back. So there's a huge gap, I feel, right now, because every now and
absolutely.
then...
Dr. Maheshwari, I'll come back to you. Let me get in some more viewers. Dr. VN Jha calling in from Bangalore. Dr. Jha, go ahead.
Uday, very good afternoon to you. I've been seeing your channel, and I thank you very much for putting the plights of, so many of the people who are affected with the COVID. I just had 2 points to suggest. See, I am also one of the person on the National Health Line, a doctor, trying to attend to the all home isolation cases in Delhi. And secondly, I'm also on the panelist on the research and development on the medical research. Now, what I want to suggest to all your viewers is, please don't panic, because most of the cases belong to the mild category, and they all can be treated at the home itself through the home isolation. Yesterday also, all the 3 distinguished doctors had appealed to everyone that if the symptoms are mild, if you are asymptomatic, please stay at home. There are very few medications which are required, which can be given to you, and you can be managed there. What I'm seeing is today I have 51 patients on my list of home isolation, out of whom someone who has got the pulse oximeter reading SpO2 of 94 or 93, they are panicking so much to go to the hospital, which is not required at all. Any SpO2 reading 90 and in excess of that can be very well managed at the home itself. Don't panic. Please take symptomatic treatment for the fever and some other things. We 400 doctors, we are on the National Helpline to attend to such cases. So please do give a call to the National Helpline. Some doctor will speak to you. He will assess onto your bedside, and then he will suggest to you whether to go to the hospital or not. Because right now there is no bed empty. No, there is no vacant bed where we can send the patient. So in spite of putting them into the distress of sending to the hospital, if we can manage them there, I think we'll be doing the great service to the humanity. Secondly, among the home isolation, There are a lot of cases who are not getting the basic medicines as well as the pulse oximeter. I want to put a suggestion to Mr. Arvind, CM of Delhi. Once you have announced that you are going to give the oximeter to everyone, please do make arrangements to provide one oximeter to all fever cases at least who are corona positive. Because that pulse oximeter is the only thing that we doctors, when we speak on the telephone to the patient, that suggests us where the patient is heading. So through you, I want to put this one request to the Delhi CM or Manish Sisodia, whosoever is there. Please provide the basic medicine and the pulse oximeter to everyone who is under home isolation, and that you will be doing a great service to the humanity.
Yes,
Thank
that's
you,
a good suggestion, that of course an oximeter must be provided to all patients who test positive, and everyone should not panic, Dr. Jha. Arvind Vachasvi, let me bring you in here. You know, people need to be told not to panic, not to burden the system if they do not require hospitalization. This is an illness which, if mild, can be treated at home. You know, people should not hoard medicines or you know, oxygen cylinders if they don't need it. Arvind, that question is for you. You'll have to unmute yourself. Yeah, go ahead.
Can you hear me now?
Yes, yes.
Yes, thank you. Thank you very much for having me here. I think what you rightly mentioned is that at this particular point, what we definitely need not do is, start panicking. I think that India, the way how India has really responded to this entire pandemic is something that's something to be complimented. All of us, we need to understand that, nobody's really prepared for, a pandemic like this. And having said this, I feel that where India really has an edge over the other countries is that apart from the entire vaccination drive, we also have the entire traditional systems of medicine, the entire Ayush systems of medicine that has its birth right here in India. We do understand that a whole lot of these symptoms per se can be attended to a little lifestyle changes. You ensure that you have COVID appropriate behavior when you go out. When you're there at home, you practice more hygiene, and of course ensure that you eat healthy. And one particular thing that what I would like to make a mention over here is that the aspect of modulating your immunity. And this is where the entire Ayush systems also have really seen that how they've contributed to maintain one's health during this entire pandemic. Yes, we definitely need to ensure that all systems of medicine come together and do a lot more research and not have prejudice on any one particular system of medicine. I feel that everybody is on a level playing field, and we really need to see that how we could come out with solutions. At the same time, I feel that one important aspect that all of us need to also take care is the aspect of mental health. And this is something that what I've seen, especially last year where Gurudev Shri Ravi Shankarji, he had meditations happening every day. So more than 4 million people would come and join in. What does this really show? It really shows that people go across through a lot of mental trauma. And this is something that has again come up in the second wave, especially to the frontline workers. So I do urge all the frontline workers also to take in some time, and also meditate, for 5-10 minutes, at least in the morning and evening, to see that they themselves could also get rid of their stresses. It is very important that we as citizens also treat all the frontline workers as also human beings. They're not machines. We need to see that we bring across our solidarity with them and ensure them that, that we are also there with them and they're doing their best for us. So yes, the aspect of both immunity, lifestyle, and also vaccination, all of them need to go across. And that's where, even at Trishi, that's why we've been really championing the cause to see that how we could, modulate one's immunity, not only boosting, but also modulating is the key word that what we're seeing right now. We've seen a whole lot of clinical trials that have come across from the Ayush system, and a whole lot of the clinical trials that have happened here in the country are very encouraging. And I do hope that both the systems come across and come along together and work as one and really put country and also people's health first. And that's something that what I feel India has always been championing. It's unity in diversity. And this is something that what I really feel we can champion together at this very, very tough and challenging situations the entire world is going through. Thank you.
Yes, indeed. Let me quickly yes, Dr. Maheshwari, I know you have a point to make, but I want to go back to Dr. Gilada at this point as well. Dr. Gilada, what led us to this situation? What led us to this situation of our infrastructure being so heavily overburdened, to have these SOSs on social media, to have oxygen running out at hospitals across the country, particularly in Delhi? What has led us to this situation, Dr. Gilada?
You see, the highest blame goes to the virus, double mutant, triple mutant, and the infectiousness of the virus. We cannot only blame people, because people are the same. They were the same last 1 year. In between, little bit they left their lifeguard, but thereafter again they are the same which they were earlier. So if people are the same, they were the same, and if virus was the same, this situation would not have come. But virus being highly infectious, nobody predicted that this such an infectious virus will come. Initially, we also scientists thought that it's better to have an infectious virus than a lethal virus. But when you calculated the lethality caused by this infectious virus, that is much more than the lethality of the less infectious virus. And to give you example, last year RO or R naught of the virus was 1:1. 1% during the infectiousness of 10 days would infect one more person. And this time it is infecting 2 more people. So if it is 2 more people, it's not double. In 10 days, 1:2. In next 10 days, 2:4. In next 10 days, 4:8. So 7 times, 8 times, 10 times increase. And that's what we have been seeing. Exponential increase in all over the country. Whichever state you take, whichever city you take, their numbers are 8 to 10% more than yesterday. So in 10 days, it is 100% more. And this is a very peculiar problem. My friend has been telling about Ayurveda, etc. This is a fire outside. We need a fire extinguisher. We don't need to debate on Ayurveda is better or allopathy is better. We need something to be done. There are something immediate measure, next immediate measure, and then long-term measures. So currently we need to do whatever is required and best required to augment oxygen, to augment medicine, to augment beds, and also to plan and tell people that if this is the situation today, tomorrow you fall sick, where is the oxygen for you? So at least mask up. So use oxygen shortage to advantage of making a mask movement again. Otherwise, people are not going to listen. As we were discussing, either you lock down the whole country or lock down your mouth. There are only 2 things possible. The third thing is not possible.
Let's leave it at that. My thanks to all of our guests for joining us on this broadcast.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.